Welcome everyone. Thank you for joining us for today's session. My name is Alina Schwarz and I'm the editorial assistant of the World Stroke Academy, the core educational project of the World Stroke Organization. Our topic today is how to do a systematic review, presented by Dr. Alex Pollock. Joining us today is also Professor Peter Sandercock, Emeritus Professor of Medical Neurology at the University of Edinburgh and lead commissioning editor of the World Stroke Academy. So with no further ado, I will hand over to Peter, who will introduce today's speaker.
Welcome everybody, and thank you for tuning in to the World Stroke Organization and the World Stroke Academy. So I'm delighted to welcome Alex Pollock, who is a senior lecturer at Glasgow Caledonian University and a member of the Cochrane Stroke Group editorial board. So she's an internationally recognized expert in systematic reviews in stroke, but also works in other areas of systematic review. Her talk is derived, of course, from her work and also linked to a paper on the International Journal of Stroke on how to do a systematic review. And you'll get a link to that later in the talk. So over to you, Alex. I look forward to hearing you talk on how to do a systematic review. Thank you.
Thank you very much, Peter. I'm just going to present my slides. I think they should just be coming. Oh, are you seeing my slides?
Yes.
Yes. Great. Well, thank you. So my talk, as Peter said, is how to do a systematic review. And again, as Peter has said, it is based on the paper that was published in International Journal of Stroke in 2018 on that topic. So I am mainly going to talk about how to do a systematic review, but in the way of introduction, I'll briefly say why you might want to do a systematic review and what a systematic review is. So why might you want to do a systematic review? Well, I'm sure that everybody will be fully aware that there are multiple primary research studies published every day all over the world and often on very similar topics. So a systematic review, which brings all these studies together, is recognized to be the best form of evidence if you want to make an informed decision about a form of treatment. So a high quality systematic review has got a number of advantages. It will keep you up to date, save you time. It means we haven't got multiple people reading the same multiple studies. And in that way, it will also avoid research waste. It will comprehensively find all the studies, so you're not missing something when you're looking for evidence. So in this way, it really should support the delivery of evidence-based healthcare. So this graph here is one that's been taken from the paper, and it shows the number of randomized controlled trials and systematic reviews specific to stroke. And you can see that there are loads and loads of randomized controlled trials. So now there are, in fact, more than 10,000 randomized controlled trials relating to stroke, far more than anyone is ever going to read, and really demonstrates the need to have systematic reviews. So what is a systematic review? Well, the definition that I like to use is that it's a research method. So a research method in the same way as a primary research study, such as a randomized controlled trial is a research method. And it uses explicit reproducible methods in order to bring together primary research studies. And importantly, it critically appraises or assesses the quality of the studies that it brings together. So it brings those together within a synthesis, and it may or may not include a statistical analysis, often known as a meta-analysis. And again, very importantly, what a systematic review does is set out to answer a clearly defined research question. So then, how do you do a systematic review? Well, I always think of there being four main stages in doing a systematic review. Firstly, the planning. Secondly, the protocol. Third, conducting the review, and then finally, publishing, disseminating. So I'm just going to talk through each of those four stages in turn. So starting with planning. There are lots of things that you should think about before you start and set off doing a systematic review. So firstly, you're going to think about what your research question is. It may be that you have a particular topic that you're interested in. So you might be saying, I'm interested in constraint-induced movement therapy, but it's very important that you drill that down into a specific focused research question. And there are all sorts of different types of questions that you might think about asking. So you might ask about what's the effectiveness of constraint-induced movement therapy compared to some other sort of intervention. Or you might be more interested in what stroke survivors' experiences are of carrying out constraint-induced movement therapy. The type of research question that you're asking will very much inform the type of systematic review that you're going to want to do. So if you've asked that question about effectiveness, then you're going to want to do a systematic review of effectiveness, such as a Cochrane review, which tends to bring together randomized controlled trials. But if you've asked a question about stroke survivors' experiences and views of an intervention, then you're going to want to do a systematic review of qualitative evidence. Having drilled down and decided on your question, then it's very important to take a bit of time to think about, actually, is there systematic review needed here? Is it a priority? Is it something that matters to stroke survivors, carers and health professionals? And has somebody already done that bit of work? Because if they have, then you're just going to contribute to research waste by spending your time doing it. There's a number of resources and places that you can turn to answer those questions. So within the UK, for looking at whether things are priorities, there's an organisation called the James Lind Alliance, which works to identify the shared priorities of patients, carers and health professionals in a number of different healthcare areas. And I was actually involved myself in a James Lind Alliance priority setting project looking at priorities for life after stroke. And you can find the priorities that were identified in that project on the website here. However, this work was done in 2011, so arguably is somewhat out of date. But there is now, again within the UK, another priority setting partnership actually ongoing at the moment. This is going to look at research priorities of stroke survivors, carers and health professionals again, but this time right across the whole stroke pathway. So the results of this project are going to be really important in terms of knowing whether things are priorities. This is due to publish early in 2021. So then you're asking, is there already a review or is somebody else doing a review at the moment? A good place to look in terms of stroke is DORIS, the Database of Research in Stroke. This is a database which is maintained by Cochrane Stroke and it's regularly updated. And largely what you'll find within DORIS is references to randomized controlled trials and systematic reviews. So on the landing page here, you can see that when I last looked, there were references to over 2,000 systematic reviews. Also within DORIS, you'll find the protocols to Cochrane reviews, so you can check whether there are any ongoing Cochrane reviews. If you want to check if there are ongoing other types of systematic reviews, a really good place to look is Prospero, which is an international register of systematic reviews. I just did a quick search of titles looking for the word stroke, and you can see on the screen there I found I found 856 records of ongoing systematic reviews to do with stroke. So really important to check these and check that somebody else isn't doing and answering the question that you have. So having decided that it is needed and there is a gap there, then you need to think about the feasibility and the scope. Have you actually got the time, the resources and skills to carry out the review that you're thinking about? You can think about how broad and narrow you make the question in order to try and address issues of feasibility. So for example, if your question was, do interventions improve walking after stroke? That would be a very, very broad question and you would have masses of studies to include within that. So you might think of narrowing that down. You may decide to focus just on one intervention. You might ask, does treadmill training improve walking after stroke? But what you need to think about then is if actually you're asking the question that's going to be useful to clinicians at the end. Are they interested in just that one intervention, or would they rather know about a whole comparison of different interventions? So having decided that you are going to do the systematic review, then you're on to stage 2, which is to do and write your protocol. So protocol is basically a detailed record of everything you intend to do. But if somebody else comes and reads your protocol, that should give them enough information that they could reproduce the work without having to speak to you. There isn't enough time here to go through every single aspect of what you would put within a protocol. However, I'm just going to briefly talk through the main stages which are on the screen just now. So firstly, you're going to be thinking about clarifying your aims and objectives, and these will come from the question that you're setting out to answer. So if you've asked a question about effectiveness, then you're going to want to define your PICO elements. That's the participants, the interventions, the comparisons, and the outcomes. And if you've asked different types of questions, there are other different elements that you may have to define as well. I think it's important to always think about your secondary outcomes as well, as often within stroke there are multiple outcomes that we might be interested in, and it's important to predefine what these, so you're not then biased by the studies that you find when you bring them together. You're then going to talk about write about how you're going to find the relevant research. So this involves writing a search strategy, and my advice here would be to involve an information specialist in helping to do that. But as well as having to write the search strategy, you should say who's going to do what, who's going to run the search, who's going to screen the records, who's going to look at the abstracts. Are you going to have 2 people looking at the abstracts? If so, what are you going to do if they disagree? So lots of questions to think through and answer. Then you'll move on to the stage of writing about how to collect the data or how to do data extraction. And when we're doing a systematic review, and we use the word data to mean any information from the primary research studies. So that can be information about the methods of the study, or information about the participants that were included in the study, as well as then quantitative data about the outcomes. So you need to say what you're going to collect, how you're going to do it, and who's going to do it. So again, are you going to involve 2 people in that process? Very important to say how you're going to assess the quality of the studies. And there are lots of tools available for quality assessment or quality appraisal. If you're doing a systematic review of randomized controlled trials, then you might want to think about using the Cochrane risk of bias tool. Then you'll move on and define actually how you're going to bring this evidence together. This is something I think quite often people forget about, and they don't say how they're going to do this. So are you going to write a narrative about the evidence that you found? Are you going to produce tables, or are you in fact planning to do statistical analysis? And if you are planning analysis, then you need to write a full analysis plan. I think it's very good practice to think about how you're going to summarize your findings. Really nice if you can draw a blank summary of findings table and have that within your protocol. And finally, you need to think about how you're going to interpret this evidence. At the stage of assessing the quality of studies, you've looked at the risk of bias of individual studies. But once you've brought all these different studies together, then what's the joint shared quality of evidence? And there's an approach called the GRADE approach that is really helpful at talking you through the stages of doing this. What GRADE does is give a considered judgment about how certain you are or how confident you are in the findings that you've brought together. When you have written your protocol, very important then to make sure that it's published in order that it's transparent, again, to avoid research waste and people then duplicating and working on the same review. So then you're on to the third stage, which is conducting your review. Because you've written your very detailed protocol, then it's just a matter of working through the stages. You've said exactly what you're going to do. So you work through each of the stages, doing what you said you would do, recording the results as you go, and then you write that up at the end. And then you've written it up, so you're publishing it, but very important to also think about other forms of dissemination. So for example, when we did a Cochrane review relating to physiotherapy, we asked physiotherapists how they wanted to see the results of that. And they said they didn't want to see the full review, they wanted a 2-page summary. So we were able to disseminate that to that audience in the way that they wanted. As we've already said, there are new studies published all the time. So it's good practice to think about how you're going to keep your review up to date. Are you going to regularly rerun your searches, which would obviously be the ideal. So that is a rather whistle-stop tour through how to do a systematic review. The paper, which is referenced on the screen there, has got much more information and points to lots of other resources in terms of how to do a systematic review. And on the screen there, also the links to the various websites that I mentioned. Thank you. Back to you, Peter.
Thank you very much, Alex. That was a really nice, clear summary of the enormous amount of work that's involved in a systematic review. And when I give talks about systematic reviews, there's there are a number of really common, frequently asked questions. And the first one that I'd like to ask you is, how on earth do you choose the topic for your first systematic review? What did you do?
Well, my very first systematic review was actually a Cochrane review. And that actually directly came from a survey of physiotherapists. Well, it was a survey of allied health professionals to ask them what their burning questions were in stroke. And at that time, which was 1999, physiotherapist's burning question was, does Bobath therapy work? So I, at that point, then chose to do a very broad systematic review to look at evidence for any different approach to physiotherapy. Not an easy review to do as my first review, but a review that's still on the Cochrane Library and is regularly updated.
Thank you. And so in other words, you had quite a wide consultation to find out if this was an important question, and it also kind of honed you in on a very specific question.
Yeah, so the physiotherapist had a very specific question, and I think if we had done a review just of that, it would have been very narrow and arguably less clinically useful, because if we had just honed down on that one named intervention, we would have missed out evidence on all the alternatives, because actually what physiotherapists were asking was, is Bobath any better than other things? So we had to include a review that included all those other things as well.
Yes, because I think, you know, when we think about other interventions in medicine, you can go for a very specific thing, such as a single drug, let's say one particular type of anticoagulant, whereas actually what you want to know is about that general class of drugs. Let's say, for example, knowing whether novel oral anticoagulants are substantially different to traditional vitamin K antagonists. And so again, I think it's a really important point you make there, to think about, do you want to be really focused, which, for example, if you focused on one novel anticoagulant, that's not the most relevant question. What you want to see is all of the drugs in that class. So I think that's a really nice point you made there. The next thing, you talked a bit about searching. And I suppose in the days of Google and Google Scholar, I think a lot of people think that you can just type in a few keywords into Google and find most of the studies you want. What do you think about that?
I think you miss things if you do that. You know, I think if you want to do a systematic review, then you want it to be comprehensive. You want to know that you're not missing some large study that just somehow hasn't got up the Google rankings. And there are multiple specialized registers that have studies on them, and it really is worth searching them. Personally, I always turn to an information specialist because I don't trust my own ability to be confident in finding those. And there are different databases which are possibly going to be better for different questions, and information specialists can guide you on that.
So by information specialist, that may often be the librarian.
Yeah.
And the other question is, we know that there's quite a lot of unpublished data, or data that's published in sort of the grey literature, which, if you find it, may really make a difference to the overall conclusion of your systematic review. I mean, I recall there was an interesting review of calcium antagonists for acute stroke, where if you looked at the published literature, it looked to be very promising and positive. But actually, if you dug out the trials that were completed but not reported, the treatment looked really neutral and it, you know, had no effect. So what advice do you have about finding, you know, work that's, as it were, hard to find?
Yeah, well, firstly, you're absolutely right. I mean, that's the whole thing of publication bias. And I think if you do a systematic review and only include published studies, then you may be, as you say, be missing a whole bunch of studies that haven't been published, maybe because it's difficult for them to get into journals, possibly because they've had neutral or negative results. So very important to search for those. There are a number of different ways. There are actually various databases of grey literature, which you can search. I think in these days, actually contacting and using social media and planning to do that is actually good practice. So whether that's on Twitter, if you've got networks on there, actually advertising the fact that you're doing this review and asking people if they know of work that's been done, that has proved quite useful for many of our reviews. I think some of those things that various people know about and haven't got into journals.
I think that's a really nice point, because in the, when I was doing systematic reviews 20 years ago, it relied purely on just knowing who was doing what. And of course, social media now makes that a whole lot easier. So that's a really nice point. So to summarize then, so you need help from an information specialist, and you now need to think about using social media to find out what's nearly published, not quite published, should be published, but hasn't yet been accepted by a journal sort of literature.
Yes, yeah.
Okay. And then, so I'm getting the feeling that you're going to find a huge amount of stuff out there, thousands, maybe even tens of thousands of potential articles that may refer to studies that you want to include. So let's imagine you found, say, 10,000 references to potential articles. How on earth do you cope with that list of possible things that you might have to include to whittle them down?
Well, if you're doing a review to do with stroke rehabilitation, 10,000 is not very many in my experience. So yes, you are likely to be working with tens of thousands. So you will go through, it doesn't take, it's not as awful as it sounds. If you've got those long list of thousands of titles, screening out the irrelevant titles is actually a fairly quick process. So what we tend to do is...
Can I interrupt?
Yep.
So you've got a computer file,
yep,
which is a list of the titles.
Yes.
So what in practical terms, what do you actually do?
So where we've got the titles, we will have one person go through and screen out the obviously irrelevant titles. So there are various ways you might, in practical terms, make that easier. So if you're working in a software such as EndNote or Reference Manager, you might choose to do a search of those. So if you're doing something on stroke and you become aware that actually there's lots of titles that have come up which are actually to do with MS, you could actually do a search and pull up all those ones on MS, and that then makes it quicker to go through. No, this definitely isn't stroke, definitely isn't stroke, definitely isn't stroke. Still looking at each title, but I find that's much quicker and a practical way than just having a sort of random group of titles.
Okay.
You can work through those titles quite quickly.
And then, so we could imagine if one person goes through, they're not gonna miss, they might miss one or two. So when you've kind of coned down to something a bit more focused on the subject you're interested in, do you get one or two people or a team of people to look at what you've then got in terms of titles and abstracts and sort of preliminary information? How do you go about that?
So again, that's going to depend on the resources and the people that you've got available to you. So you should have said within your protocol who's going to do that. Ideally, I would say that you should then at that stage be looking at the abstract. So one person has screened out all the irrelevant titles, and you then have your list of abstracts. And I would advise you have two people at that stage to independently apply your inclusion criteria to the abstracts. So really then, if it's a review of effectiveness, you're looking at your PICO elements. Are the participants right? Is the intervention right? Is the comparison right? And has it got the right outcome?
Okay, so that's really helpful. Then if the two people agree, that's fine. And if there's disagreement, you can discuss it and decide what to do with the particular paper.
Yeah, so there's two strategies that people would use on that disagreement. So either teams will decide that they'll ask a third person then to help them decide, and you bring in somebody else to sort of adjudicate, or you have a discussion between the two original people.
So I think what's beginning to emerge then is that a systematic review is a kind of team effort. You really need at least 2 people to avoid bias in the selection of studies, but probably because there's a lot of work involved, you need a group of people to work on it. And I guess that must be quite nice if you've got a group of friends working on a systematic review.
Yeah, if they can stay friends, that's great. So yeah, yes, and so some of our reviews, which are on, again, quite complex things, we may involve a group of clinical experts, and we have them as a group supporting the review along the way. So we might do the abstract screening as 2 independent people, and then where we've disagreed, we may then send bunches of abstracts to the relevant clinical expert to get that more clinical input into the review process.
Okay, that's lovely. And then the next thing is obviously the meat of the matter, which is, what are your kind of top tips for actually extracting the data when you've whittled down to the studies you think you want to include? Are there things you would advise people to do particularly?
Have a data extraction file of some sort. So whether that's in Excel or in some other sort of software, pre-plan your extraction form. Or it might be a Word form, might be handwritten, but have a form that you're going to extract into, and test that form on a small number of your studies before you set off and do all 60 of the included studies.
So that might include the name of the study, the date it was published, key aspects of its methodology, number of people randomized.
Yes, there'll be a vast number of things. So you can largely think about of information about the study and its methods, and that will help you then when you come to do your critical appraisal, because you're detailing the quality of the methods, and then there's a whole lot on the actual results of the study.
And certainly from my own experience, when 2 people extract data from the same publication, you often don't agree as to how many people were randomized, how many people were followed up, and how many were, had particular outcome events. Any tips on dealing with that?
Yeah, I think that process is slightly different now that most of your papers you're looking at, you may well have them electronically. So what you are now able to do, and I would certainly do, is to copy and paste the relevant section of text from the paper into your data extraction file. So often what our teams do, we'll copy and paste, and then we have a second column or box where we then categorize or put the number, which saves lots of time in the future, because then if there is that disagreement, you're not having to go back to the paper.
That's a really nice tip. Thank you. Okay, and then the last one is this business of an analysis plan. And I think some people think, well, we get the data together and then see what we've got. Just tell us why that's a bad idea.
It's the whole reason, the same reason for not having your protocol. It's a bad idea not to pre-plan what you're going to do. Anything you haven't pre-planned, you can then get biased by what you found. So it might be that, you've said that, if you don't say what your primary outcome is, so if we're doing a review to do with walking, if your primary outcome is independent walking, and then you find lots of studies that don't report independent walking, but they're sort of to do with walking, and they report walking speed or some other variable related to walking. Then what you end up with a review that answers a question about walking speed, but not about independent walking. So you've become biased by what's in the studies rather than by answering the question that you originally set out to answer.
Absolutely. And I think the other thing, of course, is that if you're collecting lots of data from lots of studies, it can kind of get overwhelming, that you lose your way in this mass of data. It's a bit like when you do an observational study which collects lots of bits of data, and then you don't know how to interpret it. So I think it is a great way of not getting lost in the data.
Yes, and your statistical analysis, like every other part of the review, there's lots of choices you need to make. There are different types of analyses and different models of statistical analysis that you can use. So again, pre-planning that is really good to make sure that you don't sort of keep playing with it until you find the result that you're looking for.
Yeah, that's a lovely point, and that's a great point to end up on. So I guess that also means, where possible, you need to involve a statistician, at least at the protocol planning and protocol writing stage, and also, once you've actually collected the data,
Absolutely, yes, yep.
because systematic reviews are getting pretty tricky these days. So I think that's a really nice way to end, and it's been a really useful summary, I think, for a reminder for me, and I'm sure will be of great help to those out there who are thinking of doing a systematic review, which of course is the precursor to any new research. Before you start doing any new primary research, you need to check that you're fully aware of what's out there in the literature. So this is a great first step in research. So on that note, we'll say thank you very much to Alex, and we'll hand back to Alina in Vienna to wind up and close the recording. Thank you very much, Alex.
Thank you.
Yeah, thank you, Alex, for this fantastic talk, and thank you, Peter, both for this Q&A session. Just a reminder to our viewers, for updates on the webinar series, please check the WSA homepage and our social media at worldstroke.org and at worldstroke.ed. And I'd also like to thank you for watching, and we hope to see many of you back for our next webinar on April 7th, when Julie Bernhard will present on the science of developing stroke rehabilitation and recovery studies.